Welcome back to Season 6 of the Group Practice Accelerator podcast, brought to you by Polaris Healthcare Partners, where we leverage decades of healthcare and business experience to drive growth in successful group practices just like yours. If you're a healthcare entrepreneur and you're interested in building, scaling, or exiting your group practice, you've found not only the industry's leading resource for business education, but a team of trusted advisors dedicated to helping you achieve and exceed your goals. In short, the team at Polaris creates clarity, confidence, and results. I'm your host, Jamie Falash, and the Group Practice Accelerator podcast is on the air. Hey everyone, thanks for joining me again this week. Well, for those of you watching on YouTube, you can see we've got a full house today. And if you're listening on your favorite podcast platform, let me tell you that I'm one of 4 on the show today, which is out of the norm for us. It's usually just me and one other person. So I'm really excited to introduce today's guest. So let me set this up for you a little bit first. As you know, on the show, our aim is to provide resources for group practices so that they can grow in the most efficient, cost-conscious way, because at the end of the day, what we want to do is land in a reproducible place that optimizes your operations and maximizes practice value across the organization, right? And founders and their equity partners want to enjoy that increased value. So things like predictability, repeatable structure, and streamlined processes are really essential, as we all know. And directly tied to those streamlined processes is the equipment and the systems that you select for your organization. And that's all got to stay up to date and well maintained for, a whole laundry list of reasons that probably covers everything from patient expectations, very important, to workflow demands and just a whole lot more. But those equipment needs also come with financial considerations, as you know. Things have to be maintained, replaced, repaired, which we know can be challenging when you're trying to preserve your capital to grow your footprint and add locations. So today, in the interest of keeping your organization growing at that pace, the same pace that you put in your strategic plan, and to keep top of mind those expenses that go along with keeping your operatories running smoothly, we have a comprehensive solution that we want to show you. And that's brought to you by our friends at Darby, Dentalese, and Uptime Health. And it's meant to help you keep your growth capital intact and allow you to equip your ops as you need to. And more importantly, to remove kind of that surprise repair expense that nobody likes to get. But I don't want to give too much away yet. I'm going to let our guests do that. So please help me welcome Jeff Daly, Vice President of Darby Group Companies, Heather Trombley, President Dentalese, and Janesh Patel, CEO and co-founder of Uptime Health. Welcome. We're excited you're here. Welcome to the show.
Thank you.
Yeah,
Thank you for having us.
Well, good. So why don't we first, before we get into any specifics on your solution and the name and all of that, can you first introduce yourselves and let's tell our audience a little bit about who you are and how you support group practices at your respective companies. Janesh, why don't you go first?
Janesh Patel, one of the co-founders and the CEO of Uptime Health. Today, we support group practices by providing software and service solutions to make sure that they understand how to take care of the equipment they have in their practices. And that's why, partnering with Darby and Dentalese on this platform at TotalOp is something that is just in our lifeblood. So we're looking forward to seeing how we can change how people think about it, continuing to reduce costs and creating a more controlled cash flow environment for everybody. So thanks for having me.
All right, sounds good. Heather, how about you?
Again, thanks for having me. Heather Trombley, I'm the president of Dentalese. I've been with the company about 11 years now. And Dentalese is an equipment manufacturer. We make core equipment used in everyday procedures. And the reason I'm so excited about what we're going to talk about is because equipment, can be commoditized and can be looked at as a necessary evil. But we've got a much different thought process around the how equipment can enable productivity, profitability, even increased revenue. And so we've been on a journey over the last many years to smartify that equipment and really build an ecosystem that supports group practices. And that's what I'm here to talk about is how equipment can actually be a value add in your organization and not just an expense or an unplanned capital replacement, but how we can help with our partners, Darby and Uptime Health, really bring new productivity and new revenue to the table, all while preserving capital.
I like that perspective. Jeff, how about you?
So I've been with Darby for 23 years. Today, among my few priorities is helping us develop solutions that our practices need, and that includes group practices, DSO solutions. So that's one of the reasons we're excited to partner with both Dentalese and Uptime on their respective offerings. We work with practices to help obviously with spend optimization, but also really provide operational services and solutions that help them with the challenges they face on a daily basis.
This all seems like a really natural fit, but I'd love to hear from you. Like, tell me how you all created a solution and what led up to your collaboration together. How'd you identify that need? And then I have a whole bunch of questions that I'll ask each of you.
So I'll defer, I guess, to Heather. She was the brainchild to start this project for all of us.
Okay.
It was her baby to start with, and she got all the parties around the table and started brainstorming through what this could look like. So Heather, I'll defer that question to you.
So, well, thank you. I don't know about it being, I guess it is a little bit my baby. Uh, so as an equipment manufacturer, we provide a chair, light, we have dental handpieces, amongst all the brands in the Dentalese portfolio. And we recognized, as the trend of DSO growth and, what's happening in consolidation around offices, single practice offices, even the consolidation within group practice to larger group practices, how can we be relevant as these organizations scale?
Mhm.
What can we do with our equipment that could be impactful? And we developed some technology that's really made possible by the Internet of Things, IoT, but it's the enabling technology that really supports the fact that our devices are now smart and connected. And so bring in the partnership. Can we do something with partners if our devices are smart and know something about their operating condition, or even more importantly, know something about the operating parameters of the patients and the procedures in which our devices are being utilized? And we can marry that with the software and the service and the smarts that Uptime Health brings in terms of asset management, looking at opportunities for revenue, looking for automation, and we can feed that ecosystem. And then, of course, adding Darby to the mix and having the entire complete suite of solutions. What brought us together is recognizing that group practices, single practitioners need this, but they don't
Mhm.
have a one stop shop. It takes partnerships, it takes a village to build out everything they need. And through our partnership, I'm going to probably hand off to Jeff again to say what we've packaged together requires all three of us. And it's a true start to finish or womb to tomb solution that once you identify you have a need for your office, we take care of every bit of that need from the beginning quotation and the identification and selection of equipment as a partner all the way to the end of the life and every service and every interaction you have with that equipment in between. And we take all of that um, challenge for our practitioner partners and we take it upon ourselves as this three party group to make that happen for the group offices. And that's what's revolutionary and new.
Yeah, that's something that I can see a great value creation having come from years of clinical practice back in the day. A, you don't know what's happening with your equipment. B, surprise expenses are highly unattractive to your budget, especially when you're trying to add locations and grow. And just being able to monitor all this and keep your practice running smoothly so that your clinicians can produce in a way that's valuable to patients and valuable for the practice. So I can definitely see a need, but can you tell me more about what all does this solve for a group practice? Actually, Jeff, maybe you could go first this time.
Sure. So maybe to answer the question, Jamie, if you'll bear with me for 30 seconds, I'll take a step back and just at a super high level talk about what TotalOp is, the
Yeah, let's
concept
start
of it,
there.
and
That's
that I
good.
think will feed into, what's included and what that solves for practice. So, I think TotalOp, one of the reasons I'm really excited is TotalOp is an all-inclusive subscription for the equipment in a dental practice. I say all inclusive because in a single monthly fee, it covers the cost of the equipment, all the installation expenses, the shipping, all the stuff that you would traditionally associate with a capital equipment purchase. But it also includes a license to that software that Heather was talking about that enables the remote monitoring of the equipment.
all
Mhm.
of the preventative maintenance on the equipment, all of any cost for labor or parts during the subscription. It's really everything related to that equipment, including, as Heather mentioned, having three partners that have a vested interest in monitoring that equipment for the practice, so they don't have to do it. Right? It's a relief for them. It shifts the liability and the responsibility from inside of the four walls of the practice to the three partners. So I think that's just helpful context on what the high level concept is, and I think that feeds into really four main things that I see it solves for practice. One you touched on, Jamie, is just financial uncertainty. Right, no surprise repair bills when you're part of TotalOp because it's all included in the package. The second that I touched on briefly is it frees the staff inside of the practice to focus on patient care and business operations and leave the management and the maintenance of the equipment to the experts, right? The parties that are responsible for it.
Yeah.
The third benefit is they get to reduce potential downtime due to equipment failure. I
Mhm.
think you touched on it, Jamie, especially if you're talking about the mechanical room. It typically sits in a sealed room somewhere inside of the office that is not seen until there's potentially a problem.
Oh, yeah.
With the TotalOp monitoring, now we're checking that equipment on an ongoing basis, getting live alerts if there's something going on. So we can potentially call that practice and let them know, hey, there's a small issue that's starting to occur with your compressor. We want to get in there tomorrow and take a look at it before the practice even knew about it.
Yeah.
So I think that's an enormous one, right? Is nothing worse than coming in and finding a compressor or a vacuum down inside of the practice. And then the fourth one is, I think, as you touched on early, is eliminating that heavy initial capital outlay that's traditionally associated with equipment purchases, right? It really eliminates some of that upfront financial burden.
Yeah, it certainly does. Janesh, I'll go to you for the next one. So we've been talking about, and you said it's called Total Op, and we've talked about kind of what's included. But let's get a little bit more granular on the pieces of that. We understand that it's equipment, but let's talk about what equipment and maybe what's included and how that's monitored.
Yeah, so in general, it's basically anything you'll find in an operatory, and I can get Heather to go into the different SKUs, especially Jeff and his team. They know all the different ways to mix and
Yes,
match these things.
we'll
But in
get there.
general, yeah, but in general, the idea is you get an operatory, you get a chair, delivery unit, you can get some stuff for your mechanical room, compressors, vacuums. But most of this product, or all the products that are part of the solution from Dentalese, are smart technology,
Mhm.
meaning they have IoT data flowing through them. So to Jeff's point, that's how we're allowed to monitor this on your behalf, is we watch the data feed versus having to physically go in and check. And that's part of what you get as well as this software package. That's where we come in and provide that, where somebody can easily understand what it is that they have in their office. So make, model, category, what bells and whistles, what software updates, what are the sensors what are they saying? So you can also see that data if you want to geek out on it, and I hope some people do. But that's also what we get to see. And based on all of that data flowing through the system, if there's an error code that gets alerted by the device, or if there's a sensor trending in a direction that doesn't seem favorable to the equipment, that will then ping us and our team to go out and send a technician to do maintenance on it. And we have way more information about that equipment and how to repair it than we did in the past. Now we know what the sensor's saying. So we don't have to spend extra time and then a wasted truck roll to come out on site and first diagnose and then say, hey, I'll be back tomorrow with the right part.
Yeah,
Now we can say, traditionally, this is the problem that creates that. And I'm going to have these parts in my van. So in the event that it does solve, it's right there. So I'm only using one truck roll. Everyone's happy. The doctor's happy, got fixed up and running sooner. We came in with way more knowledge about about what's going on than anybody else. And it's taken care of for you. It just feels mindless. So I think when people think about what they're buying, outside of the true manufacturing goods that Dentalese creates, and it's outside of the great customer delivery and service that Darby creates, and outside of the amazing software my team creates, it's really just you're buying peace of mind. It's
yeah,
a I always love to use a cell phone analogy at some level where it's we all own that cell phone, and a lot of us, including myself, pay that like 35, $32 a month for like 5 years, and then at the end of it you can upgrade or buy it outright. But it has Apple Care, and I mindlessly can use this phone, and if it breaks, I'm not gonna, like, worry that I just wasted 10 grand because I have to go replace this thing,
exactly.
for the chair, and it's that peace of mind I think is really what they're buying at the end of the day, so
Yeah.
that's why I love the partnership that we all have
Well,
as
and
well.
that's why I wanted to go to you first with that question because there is, above all else, I think, a consideration for downtime from practitioners. We're all afraid to have downtime in our chair. And because once that work stops, that impacts your P&L at the end of the month, right? And at the end of the week and the end of the day. So if we could have something to monitor all that and act in a proactive way and be preventive about it, to me, that creates real value. And that's why I was excited to have you all on today.
And can I say one quick thing about that downtime
Yeah.
comment? And I think this is something that we'd love to challenge any one of your listeners to think about as well.
Mhm.
Is what is that actual cost of downtime? And why is this so important to have the system monitor and be there for your behalf? I think a lot of people think about it as just the cost of repair or the cost of the labor invoice you might get on a normal thing.
Right.
And of course, we fundamentally know you're not taking care of patients, so there's missed revenue, but people don't actually calculate the missed revenue. And I
We
think
should.
yeah, I think when you think about like why this stuff makes sense and why every hour matters, it's like allowing people to think about it that way and see if they can do that homework and tell them like, what is the actual cost of downtime for your practice and does that move the needle? And looking at a total op solution. Sorry, I didn't mean to cut you off, but that was one thing that we run across a lot on our side of the world.
No, actually, Janesh, I'd like to add a comment to your comment because I think it's spot on. To for the audience listening today or watching today, we've even gone so far as to model this with a redacted DSO customer of
Mm,
scale and size, and we've studied their data and built a calculation model around 1 year's worth of real data, both lost revenue, their experiences with service repairs, and so we've built a calculator that you can find on our website that just lets you plug in your particular group size, structure, number of operatories, your revenue. You should know your, daily, monthly, yearly revenue. And with your own inputs, you can calculate based on statistically significant data. Here's your real cost. So we've done all that homework so you can start to visualize in my own practice, this might be costing me this much money. And here's an actual solution to it. So there's actual tools and science behind this as well.
yeah, and I would encourage people to go and try out that tool because, I mean, at Polaris, we are all about data. So, and we want to prove it through the numbers. Otherwise, again, why should you care? How does this impact you? So go
Right.
and see how that would impact your practice. And I love that you have that tool that people can try out there. So let's shift a little bit to you, Heather and Jeff, on the pieces of equipment because I want people to have a full picture of this before we get into more specifics on the solution itself.
So I'll start and then I'll hand over to Jeff in terms of what Darby can surround this with in terms of their overall portfolio. But
Mhm.
Dentalese right now makes basic or core equipment, as it's called. So if when Janesh mentioned operatories, we have chairs that have been smartified, the dental units, lights to the extent they're smart. And there's actually some smarts you can put in a light, by the way. So you've got the operatory package where the patient's residing. We have hand pieces and we have the mechanical room. So your core operating equipment is part of the Dentalese set of solutions that have all been smartified and that feed the data through uptime to Darby and to the practice itself if wanted.
Okay. Yeah, and that's all impacting your workflow. So great value. And Jeff, your words on that.
Yeah, I think Heather really did a great job covering what's included in TotalOp today. We've had a number of conversations about the potential to expand what's included in TotalOp's world in the future.
Mhm.
I think we're approaching that with an appropriate level of caution, given the commitments that we have to practices that subscribe to TotalOp. Right, we want to make sure that we can absolutely fulfill on the commitments, and that's one of the reasons Dentalese was such an amazing partner for this program is the quality of their equipment is second to none, right? The reliability is strong, and the IoT connectivity is something that really unlocks the potential for this, and it allows us to do the monitoring of that equipment and diagnose potential issues to resolve them immediately.
Great value for practices and really speaks to that predictability that group practices are looking for. So tell me how TotalOp can help multi-location practices and startups and even single location practices specifically. Janesh, do you want to take that one first?
Yeah, I think when it comes to multi-location practices, a lot of these groups are trying to expand their revenue base. And this also speaks to the independent office too. So don't get me wrong, but
Yeah.
it's always how can I build that next operatory to increase my same store growth, which I know is a least back in the last 3 years, has been a big theme. Now it's AI, but like, just to let you know, goes, we use AI for the software tool, so you'll still be AI forward looking at TotalOp. But in general, the same store growth has been the biggest focus of a lot of people, with the cost of capital increasing and harder to get by than any other
Yeah,
time.
very true.
And to think about how much you would have had to save before to build up next operatory, the total cost up front. Doing it this way allows you to reduce that cost, or maybe think about expanding 2 or 3 operatories instead of just one. Same thing with the people who want to do de novos that are expanding for multi-location. Again, instead of this huge upfront, uh, maybe loan you have to take to build out the whole thing,
Hmm.
you're making money back sooner than you would and paying off that capital expense way quicker. So it's another way to think about it from that perspective. And I think the last thing is, from just how to do this affordably, especially when you go and evaluate some of these new practice or these M&A style practices that you're just trying to acquire. A lot of times you're doing equipment evaluation as well, and you have to factor in the cost of replacing that. And maybe you used to say, well, we'll keep this going on for a couple more years because we got to see this practice succeed before we reinvest in it.
Right.
This allows that threshold to kind of reduce to where you can modernize that new practice way sooner than you probably would have otherwise. So if I'm a expanding group or a single practice office, I'm thinking about how do I make same store growth affordable? This is the easiest thing that we could do, which is why we wanted to come together and say, let's meet the market where it is
Mhm.
and get some feedback and say, what else can we be doing to help you with this? But this is the easiest thing and the lowest hanging fruit we can think of right now.
Exactly. And while staying within your four walls, whether that's one location or 20 or 30 locations. So you can do
Right.
that across the board. Heather, I'll go to you next with that same question on helping multi location practices, startup and single locations. Anything to add there?
I think Janesh did a great job describing, technically where we can, at scale, show more and more savings, if you will, from having some of these robust systems. But I want to bring up an element we haven't touched on yet. So, I've claimed here that Dentalese makes smart devices, and we sensor them up. This is all technology that is not new or novel. We can understand the operating conditions. But the other benefit, again, whether you're a single practitioner with one office or you're a partner and you've got 3 offices or a group, here's what I'd really like to comment on. The smart revolution in AI is really just beginning, and we've embedded in our devices not only sensors around the operating characteristic of the device itself, but we now have some very interesting and very, very financially relevant usage data, if I wasn't clear. So, if you're a DSO and your job is to really think about streamlining operations and increasing same store growth, wouldn't it be great for you to know as you're looking at your AI tools to look at your scheduling and how you're scheduling rooms and how you're scheduling patients? But what if you knew that the chair was actually idle for half of the time of that schedule and you could start to look at missed revenue opportunities because now you have your practice management system and your chair telling you information about its usage, the practitioner that you know that's in there who's taking longer or less time. And for groups that have many offices, they have a window, truly a window into operational opportunities for either more training, upsell opportunity, re looking at their scheduling protocols. And so this is actually a revenue creator. And that's the benefit of this ecosystem and having the partners is we can mine and extract this smart data that's more than just around downtime. It's really about how do I get more dollars in my uptime?
Yeah, exactly, and that really speaks to the chair utilization rate that we drive home with our own clients through
Yep.
fractional COO and strategic consulting. So I love that aspect of it. Thanks for sharing that additionally. Um, Jeff, I'll go to you with this next question. Can you talk about a little bit like the short term, the long term benefits that practices can expect?
Sure. So I think a number of these probably cross over a little bit of both, but I'll
Mhm.
do my best to try and fit them neatly in the two boxes. So I think
Okay.
short term, the initial obviously is the reduced capital outlay, right? You're not having to lay out X amount of dollars to buy like you would traditionally buy capital equipment that we're talking about. I think you also immediately get the ability to free the staff inside of your practice to focus on the activities that drive the business as opposed to just what's required to operate the business, right? As we take over responsibility for the maintenance and the repair on the various products included in TotalOp. In the longer run, we touched on reduced downtime and the importance that that has for practice. I think also, as you look over the subscription, the value in one set monthly payment with no surprises that, you can be assured you can really budget out what that's going to cost every single month without surprises has a value across all different practice types. And then finally, as I was thinking about our conversation today, Jamie, it really hit me that, think about the patient experience inside of the average dental practice, right? What's the one piece of equipment they're most likely to notice inside of the practice?
You're gonna walk in
It's
and
not the
sit in
cone
that
beam.
chair. Yeah.
They're going to sit in the chair. Exactly.
Yeah.
That's what they're going to know. How did that feel? Did it look nice? Was it
Right.
scuffed? Was it ripped? Was it old? Was it rickety? Or was it a beautiful experience when they walked into the operatory? I think if you think about the retail experience today in the world we operate in, right?
Yeah.
Every significant retail business has a refresh cycle, right? It's 5 years, 7 years, 10 years, and they're going in and refreshing the McDonald's, the Panera, the Target, right? They redo the store from top to bottom to make sure it stays up to date and it's a good experience for the consumer. I think dental practices have the ability to think about it in a really similar way through TotalOp. They don't have to make a commitment for 20 years on a chair. They can keep the practice refreshed on a 7-year cycle without having those massive capital outlays over and over and over again. So I think, that's another big piece of the value proposition long term for practices that are really focused on how to continue to enhance that patient experience.
I'm really glad that you brought that up because that patient impression, we're all focused on patient retention. What can we do to keep people in our practice in those four walls once we have them? And that first impression, not just walking into your waiting room, but walking into the operatory, it needs to look welcoming. It needs to be fresh, neat, clean, all of the above, because keeping your patient there, they have to be comfortable. And if they're seeing things that are worn, not taken care of, it doesn't just speak to them about the chair. Their impression
Exactly.
is of the whole practice. If this is not being taken care of, if these elements in your op and mechanics aren't being taken care of, what else is there?
Exactly right.
Yeah. Okay, so if I'm a doc, let's say I've got 3 to 5 locations and I'm interested in a total op subscription and getting rolling, what I would wanna know is, does the cost of that breakdown, how does that compare to, like, traditional financing models is what I'm getting at?
So if everybody's okay with it, I'll maybe take that
Yes,
one. We
go
have
right ahead.
a good amount of exposure in this world. So it's the right question, and I'll just caveat my response with it's a difficult question because there are a lot of variables at
Mhm.
play here, right? There's, what's the interest rate for that specific customer? Are they looking at a lease, a loan, accelerated depreciation? There's so many variables to bring into that total cost of ownership.
Yeah,
And I would just, to be candid, say that there, of course, is a slight premium for the service, like any service that has additional offerings, right? And additional
sure.
benefits. There are costs that are associated with that. But we've done some rough math, and we believe that most practices will find the total cost of ownership of TotalOp over that 7-year subscription to be really, really compelling. They'll end up saving money over the life of that subscription when you start to factor in all these additional hidden expenses that just naturally occur with capital equipment over that 7-year period. So, what I would encourage people to think about as they think about this program is not only that initial cost of equipment, but the cost of capital, right? So even if you're paying cash for it, what's the cost of capital over that time? What's the
Mhm.
time value of money when you have a steady payment over 7 years, right? There's value there, the cost of those repairs, and then the big one that we talked about is cost of downtime, right? I think a single day of downtime would more than pay for the premium for the entire 7 years on the subscription to TotalOp. So I think that's really where the value lies is shifting all of that responsibility to us to be the parties that are responsible for making sure that equipment stays running at optimal condition to hopefully mitigate any potential downtime your practice may experience.
Yeah, well said. Janesh, words to add there?
Jeff hit it on the head. That's why I'm glad you took that question because at the end of the day, it all is variable based on the practice itself. And so the biggest thing is peace of mind valuable to your team? Is reducing the uncertainty of cash inflow and outflow with heavy expenses whether it's, again, a repair that you're not expecting, that's out of warranty. Who knows when these moments happen, but they create operational disruption from a financial standpoint. But then also just the downtime alone outside the cost of the missed patient revenue, it's burnout for your team to have to work around these issues. Rescheduling patients. It's, can we move this person here? And that just adds stress. And does that, again, account for all the peace of mind that you get? And what is that value for you? So there's always a premium, but the premium in our mind is worth the ROI and what we've at least seen from our early data.
And I really do think that people are willing to pay for something that brings that value. Is that convenience? Is it just something I don't have to worry about at the end of the day? Like you compared it to, the insurance plan on your smartphone. Well, sure, you can go throw that in the lake and get it replaced at no cost. It is definitely worth the price of admission, I believe, for what you get for certain solutions and certain resources that you bring into your practice. And this is a really good one. I'm glad that you all were able to join me today to talk about that. For any closing thoughts, Heather? I'll go to you first.
Maybe I don't want to live too technically, but I do want to just talk about one other subtle or not so subtle benefit of this partnership and the software and the fact that these are connected devices through our companies.
Hmm.
One thing we've talked about internally is we never want somebody to have buyer's remorse. So the minute they buy that, they have a replacement compressor. They didn't plan for it, $10,000. Oh my gosh. Well, the day that hits their thing, you've got obsolete hardware because the next day the next company launches the next thing with the next feature. So not only do you have all of this protection built into TotalOp, but we've developed two-way communication with our devices. And so if you equate this to the Tesla model, we can do over the air updates and keep upgrading that equipment through the lifespan, the 7-year program. And so you never are left in the wind with old technology when you have the total op. So as the world gets smarter, as more AI comes online, as more software finds more insights and on and on and on, as we're able to mine more insights, all of that gets translated back into the devices through the ecosystem. And so I really want people to think, when they think about the life cycle of their equipment, we 3 companies really thought about maximizing the life cycle of that equipment, including the over-the-air upgrades through the years.
Glad you brought that up because that's something that, there are still people out there that push back a little bit on AI. And these are the places where it fits beautifully into your organization, right? So if you've got the ability to continually upgrade and update your equipment, excuse me, that's where this comes into play. That's where you create value and efficiency and keep your operations running as smoothly as we drive home with our clients and our audience. So I can really appreciate that. Well, so if I want to get in touch with any of you on learning more about TotalOp and perhaps getting this implemented into my practice or group, what's the best way to reach out and get more info?
Go to the Darby team is what I
Yeah.
would say.
Yeah, so if you can contact your Darby account manager. If you go to the Darby website, there's a TotalOp page right off of that will have additional information. I think it also houses the calculator that Heather was referencing earlier if you want to run through your numbers there. And if you're interested in learning more, there's 3 or 4 fields to fill out so a member of our team can get back to you. We're happy to work through any and all questions. If it's not the right fit, we're happy to just educate you on what that looks like, or if you just have questions on what's included or what it could look like for your practice, our team is well trained and happy to answer those questions as well.
Wonderful. I'll add that to the show notes so that our listeners can reach out and get in touch with you that way. But thank you all. Thank you, Heather. Thanks, Jeff. Thanks, Jeff, for coming on the show and talking about this today, because what we aim to do is to really bring value to our listeners. And these growing group practices do need guidance on aspects like this when they're looking to add locations or just grow within their 4 walls. And this is a great resource. So we appreciate you being on the show today.
Pleasure. Thanks for having us, Jamie. Appreciate it.
And to our entire audience, we love the questions that you all send us. So keep them coming, and we'll keep delivering the content that you ask for. As always, if you want to learn about any of our Polaris expert advisory services, or maybe there's a topic that we haven't covered yet that you'd like to hear about, you can send us an email to info@polarishealthcarepartners.com. And be sure to visit our website at polarishealthcarepartners.com, where you'll find weekly articles from Diwakar Sinha, our CEO, to grow and support your healthcare business, along with access to all podcast episodes, events, and a whole lot more. Thanks so much for being a loyal listener and subscriber. If you enjoyed today's episode, please share it with a colleague and be sure to leave us a rating on any of your favorite podcast platforms. We'll see you on the next episode of the Group Practice Accelerator Podcast.